Have you ever thought about having a coach for your vagina and keeping your pelvic floor in tip-top shape to prevent those embarrassing symptoms and enjoy deeper, more fulfilling sexual pleasure? Welcome to Pleasure in the Pause, a podcast dedicated to inspiring midlife women to feel more connected to their bodies, pleasure, and power through perimenopause, menopause, and beyond. I am your host, midlife and sexual wellness coach, Gabriella Espinosa, and I'm so happy that you're here. In today's episode, I have an eye-opening conversation with Kim Vopni, a self-professed Kegel maven, also known as the Vagina Coach. She is a certified fitness professional, author, public speaker, and a women's health educator passionate about spreading information on pelvic health. Her most recent book, Your Pelvic Floor, launched in March 2020 and was on the bestseller list immediately. Kim offers online programs and coaching for women in the peri and postmenopause phase of life, and her Muff app is a community from around the world who find support through her 28-day challenges and monthly membership. Today, we are taking a deep dive into pelvic floor health so you can optimize your sexual pleasure. Welcome, Kim. Thank you so much for joining me today.
Thanks for having me. Nice to see you.
Great to see you again. I know our listeners are so curious to know why we need a vagina coach in our lives. But before we go there, I would love for you to share the story of how you decided to focus your purpose and passion on pelvic floor health for women.
Yeah. Thank you very much for having me and helping get the conversation out there. And it is my mission for everyone to want to have or need to have a vagina coach. And the term came kind of accidentally, but how this all started was really with a fear of childbirth. I watched my mom struggle, but I was also a bit curious and I was asking questions about how do women have babies and still carry on with all the things that they want to do. And so when I decided I wanted to start a family and became pregnant, I was determined to have a different story than my mom. I wanted to prevent tearing and I wanted to prevent incontinence and the other things that I had seen her struggle with. And my midwives had recommended a product to me called the Espinosa, which is a biofeedback device that's manufactured in Germany. And the term Espinosa stands for no episiotomy. And episiotomies, historically, they used to cut the tissues of the perineum pelvic floor during vaginal childbirth with the intention of that helping, but it actually created bigger issues for people. And so if we can reduce the likelihood of needing or experiencing an episiotomy or even having tearing, that has shown to have better outcomes for the person. So that was my big goal. I used this Espinosa. I had a great experience. And then I thought, why is it that not everybody is using one of these? And so contacted the company, ended up becoming a distributor, kept it as a very side thing for a while. I was working in human resources at the time. And then after I was laid off from my job, I thought, okay, let's see if I can turn this into a business. So I started an e-commerce store. I started adding more pelvic health products. I started to learn more about other professions and heard about pelvic floor physiotherapy, and they started referring their patients to me. And I recognized that this is really a conversation that needs to be out there a lot more. And at the time, I was focusing on birth prep. And then I recognized that there was a need for more emphasis on postpartum recovery as well, because in our culture in North America, it's very much are pregnant and showing off our belly the whole time and very proud of it. And then as soon as we've given birth, all of a sudden the belly becomes a place of shame and we have to look not pregnant as fast as possible. And I felt that needed to change. So I started a second business called Bellies Inc. with two other women, one of which was a pelvic floor physiotherapist. Juggled the two businesses for a while. And at the time, again, working primarily with pregnant women and new moms, I was known as the fitness doula because I was combining fitness principles as a personal trainer with this group of muscles called the pelvic floor. And as I progressed and the years go on and I started going through perimenopause and I'm now postmenopause, but started to work more with women at that stage of life, and fitness doula wasn't resonating quite as much in terms of a name. So I knew I needed a bit of a brand shift. And one day, this is probably about 8 or so years ago now, I was asked to speak to a group of women entrepreneurs at a conference. And all of the speakers had been some sort of business coach, marketing strategy, anything to do with business. And I joked when I came up on stage that now you have a vagina coach for your business. And it was this light bulb moment. And I thought, that's it. It's this word that nobody likes to say. It's a taboo word. It's part of what's keeping people ashamed and embarrassed and suffering. So I'm just going to say this really uncomfortable word and apply this coaching principle to it. That's where the Vagina Coach came from. And that really kind of was a bit of a turning point, I would say, in the business in terms of trying again to normalize this conversation and to open up this uncomfortable topic even more. And so here we are, and I've been doing this for almost 20 years now, which is kind of
Mm.
so my first son, who I used the product with, he'll be 20 in a couple of months.
Yeah, I really admire and respect how you've just taken the shame out of the word vagina and you use it all over social media. I'm so grateful that social media hasn't banned that as your Instagram handle because we can find you right away. And you do have two sons, isn't it right?
Yeah. Yeah.
So they're hearing you say this word all the time.
Yeah. They've grown up hearing me say it a lot.
So great that you're removing the shame and stigma around a very essential part of our bodies. So thank you so much for that. So many of us simply don't make the connection between our pelvic floor and other bodily functions. As a yoga teacher myself, I've said often, and I think you'll agree, that the pelvic floor is literally the ground of your being and supports how you stand, walk, control elimination, and enjoy sex. It is, from a yogic philosophy point of view, it's your entry into the world, the seat of your creative power, where you find home in your body if you follow the chakra system. And so often stress in our busy lives disconnect us from this part of our bodies. And we usually don't pay much attention to the pelvic floor until we experience pain, discomfort, or embarrassing symptoms. So I'd love for you to start with the basics because it's always good to repeatedly visualize and understand how beautifully complex this layer of muscles really is. So can you talk us through the physiology of the pelvic floor, where it's located, what it's responsible for?
Yeah. And it's as you're talking, and I'm thinking, I don't know if they criticize, but people will say, why are you calling yourself a vagina coach when what you do is pelvic floor? But the two are very intimately connected. So the pelvic floor is a group of muscles, and it's three different layers. The first layer is primarily responsible for sexual response. The second layer is primarily responsible for managing the openings of the urethra, the vagina, and the anus. The third layer is primarily responsible for supporting our organs, the three most common: bladder, uterus, rectum. And vulvovaginal health as well as pelvic health are all intricately related. So those three muscles have those jobs. They also play a role in our pelvic and spinal stability because of the attachment points at the base of our spine, on our pelvis, and at the tailbone. And it also acts like a sump pump. It works in synergy. The pelvic floor works in synergy with our diaphragm. So every time we're breathing, there's a reciprocal response and an energy, a synergy between the pelvic floor and the diaphragm that helps with circulation and movement. And if we go down the spiritual side, the chi, right? And so the muscles themselves, we don't see. We can see our external genitalia. We can see our labia. We can see our clitoris. We can spread our lips and we can see the opening of the vagina and the urethra, our anus. We can see that external component, but the internal muscles we don't see. And different from me standing in front of a mirror and doing a bicep curl, I can see the muscles working and moving, whereas the pelvic floor we can't. So it's difficult to connect because we're never even really told that we have a group of muscles there. We are told about our external genitalia, maybe the tube that attaches to the cervix, which is our vagina, and that's kind of it. And because we can't see it, then we don't necessarily know it's there, but then there's so many influences that can create shame and taboo with that part of the body as well, which means we become even more disconnected. And so part of the work in uncovering and unraveling pelvic floor function is first understanding what the pelvic floor is, where it is, what its jobs are, and some of the symptoms that are signals that the pelvic floor might be sending to you, asking for a little bit of help. So things like incontinence, organ prolapse, painful sex, burning, irritation, dryness, those are all very common. And of course, that's not an exhaustive list. There can be many, and there's different types of incontinence and different types of prolapse. But the pelvic floor as a group has lots of jobs to do. We don't really appreciate those jobs until one of them isn't maybe working as well as it should. And then all of a sudden it becomes one of the only things we think about because it is so central to so many things that we do. As I mentioned, our continence management, our organ support, our pelvic and spinal stability, the foundation of our core, and of course, sexual response.
Thank you for that. And I heard you say two words, breath, which allowed me to check in on my breath. And I noticed myself breathing in and breathing out because I was holding my breath, and awareness, right? And those two things I feel are so key when it comes to, I talk about it often when it comes to pleasure, but especially when it comes to our pelvic floor, because the breath is so related to how much tension or holding or clenching we're doing with our pelvic floors. And that awareness is so key in noticing not only the signals of discomfort of the symptoms which you outlined, but also if we're holding our breath. And then, in our fast-paced lives, it's so easy for us to hold our breath, right? And have static breathing. And as I mentioned, this plays a big role in pelvic floor dysfunction. Can you talk about how the pelvic floor and our breath are so interrelated, and perhaps share with us an easy way for our listeners to bring awareness to the breath so we make sure or just check in that we're not clenching or tightening our pelvic floor?
Mm-hmm. Yeah, I've actually been looking recently for a statistic to say what is the prevalence of hypertonicity or hypertonic pelvic floors, also called non-relaxing or overactive muscles. Because when I ask my physiotherapy friends or physical therapists, they say the majority of their patient population would be considered overactive. But I can't find anything in the literature that gives us kind of a prevalence. But I would say it's quite high. A lot of people have tension there. And that could be from posture, it could be from fear, it could be from trauma, it could be from busyness, it could be from fear of leaking, it could be guarding because we're thinking our organs are slipping out of position. Like so many things can contribute to tension. And a way that we can work to release that is through the breath. So the core, if we think pretty much, I would say every single person on this listening would have heard the term core exercise or core fitness. The core we think of as the abdominal muscles. Sometimes we think of the low back. The core, I call the core four. So we have the pelvic floor, which is the foundation of the core. And on the top of the canister, we would have the diaphragm. So that's our breathing muscle. We have then on the back, muscles called the multifidus, which are little muscles along our spine. And on the front, we have the deep abdominals called the transversus abdominis. So those four players, if you want to call them, the four pieces, make up what I call the core four. And they work in synergy to do all of those things that we talked about earlier. So it's not just the pelvic floor's job. The pelvic floor, as part of that core system, is doing all of those things. So physiologically, what happens in the body when we breathe in, the diaphragm, which is sort of like a dome shape, as the ribs expand on an inhale, ideally as the ribs expand, the diaphragm is moving from a dome shape. It's sort of flattening out almost, and it's acting to draw air into the body. And with that sort of flattening of the diaphragm, what's happening below, or what ideally should be happening down below, is the deep abdominals will relax, the belly will expand, and the pelvic floor will also expand and lengthen. And that's allowing air to come in and oxygenate us, energize us with oxygen. And then on the exhalation, what is physiologically happening is the pelvic floor is contracting and lifting. The abdomen, the deep abdominals, the transversus, are co-contracting, and they are that sort of belly button to spine movement, drawing inwards. And that's all part of what's exhaling or eliminating the stale air from our body, as the diaphragm also then moves back up to its dome position. So that is ideally what's happening all day, every day as we're going about our day. But if we are, say, really, really cold and we're really tense and we're gripping in our glutes, if we're sitting in a tucked under position, answering emails in a hunched over position for hours and hours and hours, if we are afraid of something coming up later on, we are going to hold tension, and that can, over time, I'm not saying any of those are bad for a short period of time, but if we are doing it repetitively, the body will adapt, and the tension will kind of become stuck almost in the pelvic floor. And it will interrupt that synergy. So the diaphragm isn't pulling as much air in. We're not getting as much oxygen. the pelvic floor isn't going through that length and contract cycle. The abdomen is not expanding and contracting. So we may get some disruption to even our digestion. And so when we have the awareness of what happens physiologically in our body with our anatomy, then we can harness that by practicing deep breathing, or I call it the core breath. So harnessing that core four with the breath, where we know that on the inhales, the pelvic floor should lengthen. So can we add some visualization, and can we try this in different positions that would allow us to actually feel the response of the pelvic floor, so that we inhale? And I like terms like imagine blossoming your vulva, or imagine your sit bones spreading, or imagine the 4 points of your pelvis, the pubic joint, the tailbone, and the two sit bones expanding away from one another. So inviting the opportunity to release, which so many of us don't feel safe releasing. We are holding our abs in because we think that's going to make our core stronger. We're tensing in the pelvic floor because that's going to help us not leak. It's not, but that's what we think. And so it feels very scary to let go and to release tension. And then on the exhalation, we can add in a pursed lip blow. So almost like you're blowing through a straw. And then we add other cues to activate the pelvic floor and to add in a voluntary activation. Some people will have heard the term Kegel exercise. And people don't have, I think, the full understanding of what a Kegel is. A Kegel is a voluntary contract and lift and let go of the pelvic floor. So we've started with that let go. Now we're on the activation. And that a very common one that people like is think about picking up blueberries with your vagina and your anus on the exhale. Some people like to think of sipping smoothies through a straw with their vagina on the exhale. And then we would let that go, put the blueberries back down, or blossom the vulva on the inhale. And you can do this seated. You can do it standing. You can do it laying down on your back. And I invite people to try it in different positions, because some people like the influence of gravity and feel it better that way. Some people like to be just supported by the floor completely so they can feel. A wide leg child's pose is actually a really great position to feel it in, because there's a bit of a stretch placed on the perineum and the pelvic floor. So that's something I call the core breath. It's always where I start with people, so that they can get a connection to that they have a group of pelvic floor muscles, that it works with the diaphragm. And most people will do it and say, I've been doing this wrong all the time. I've been inhaling and trying to suck up my pelvic floor, and then exhaling and trying to let that go. But physiologically, that's the opposite of what the body would be doing.
Thank you so much. So your core breath is coordinating the breath with the pelvic floor muscles with the Kegel practice. Is that what it is?
Yeah. So Kegels, I started using the term core breath to, I don't want to say replace the term Kegel, but just to expand upon it, because people think of a Kegel as just a squeeze. They don't think of it as a lift. They don't think of it as the need to let go. They just think of squeezing, and they're often using their inner thighs or their butt cheeks, or sometimes they're even bearing down, thinking they're activating the pelvic floor. So I wanted to expand upon what I felt was limiting people from actually doing it correctly.
Yeah. And I think that's a beautiful visual that you offered. And I think as I was listening to you speak, I was doing the breath and trying to feel that kind of blossoming of my vulva against the chair. And there is an intentional coordination there, right? I mean, so often we think that our pelvic floor has to be tight. I mean, I think that was always the image of the Kegel, as you mentioned, that it has to be tight, but we want our pelvic floors, just like any other muscle, to be relaxed and to have some mobility. And I think that visual that you offer of that beautiful blossoming is so accurate. When I really kind of tune in and bring awareness to it, I do feel my pelvic floor opening and contracting, and I do feel that sense of mobility. Why do you think we have this sort of social construct that, our pelvic floors have to be tight and we want to have that tight vagina? I know that's a myth. Can you talk to us about that?
Mm-hmm. Yeah, there's so many different ways we could tackle that one, but there is a belief that tight is strong, and there is a belief that tight means more pleasure, not necessarily for the person themselves, but for the partner potentially. And so, and when we think about if we are experiencing incontinence, so leaking when we laugh, cough, sneeze, or sometimes even leaking standing up from a chair, or even during sexual activity, or if we're experiencing prolapse where the organs are starting to shift out of their optimal position, that can leave us feeling vulnerable again. And we, from a sexual health perspective or sexual activity perspective, we are, I don't want my partner, or I don't want them to, what if I leak? What if they smell it? What if they feel something? And so there's this guarding that happens that is also part of the belief that if I just do it more, it will get stronger and then this will go away and this won't be bothering me anymore. But as you explained, muscles have an optimal resting length where they can generate power, where they have the capacity to respond in whatever way they need to, where we have optimal blood flow and circulation. And if we are in a short, tight state from guarding or clenching, we inhibit our blood flow and circulation, and we don't have as much capacity for power or for pleasure. So when we think of sexual activity, we can think of some may have insertion as part of their sexual activity, and insertion can be difficult, could be painful if those muscles are not allowing something to come inside. We also may not be able to experience sensation or potentially orgasm as well as we could if the muscles had that range of motion to go through, had the proper blood flow circulation that we were talking about. So gaining power, gaining access to pleasure, opposite to what a lot of people think, is in the release. It's the letting go, and we have to start there first. We can strengthen, we can build endurance, and many people think of Kegels and pelvic floor exercise is as a way to enhance sexual sensation or capacity for pleasure. And yes, it can, but if somebody already has more tension and we add more of the activation, we may not be doing what we think we are. So I always start with the letting go first.
Yes, that it is that letting go, that opening up, that surrender, and that relaxation that is so key to enjoying pleasure. And I often stress that a lot. I had a guest on the podcast a few weeks ago, Christine Marie Mason, who talked about creating a ritual around breathing so that we could prepare ourselves for intimacy. So really allowing our bodies to be this beautiful receptive vessel, and breath awareness is so key to that, and just allowing ourselves to be relaxed and open. When you talk about, I'm hearing you talk about tight pelvic floor muscles, but there's also the issue of lax pelvic floor muscles. So how do we know? I know when in my own journey of trying to bring awareness to my pelvic floor, I couldn't figure out, do I have tight pelvic floor muscles or do I have lax pelvic floor muscles? What is the difference? And how do we know what we have? Or if we have any of those two things, maybe we're just normal, we're completely fine. We don't have either of those, which would be great. How do we bring awareness to understand where we are on that spectrum?
Mm-hmm. Yeah, it kind of goes back to we've never really received adequate education around this group of muscles and how to care for it, and that there are professionals that can help us optimize function. That doesn't mean that we have to see a professional. So a pelvic floor physical therapist is always who I recommend in terms of helping maintain our pelvic floor muscles. So we see a dentist every year for our teeth, for a checkup, and we go even if we have no toothache. And I believe we would benefit from that same practice with a pelvic floor physical therapist. So that is one way where they can evaluate our pelvic floor and let us know if we tend more on the hypertonic side or on the hypotonic side. Sometimes people will notice they have, like, there's an imbalance. One side might be tighter than another. And there's lots of different reasons for that. But so that's one way. Seeing a pelvic floor physical therapist is something I recommend every single person do at least once a year, even if you have no symptoms, but especially if you do. You can also self-explore. The challenge with that is if we've never really paid attention, we can't insert a finger and automatically go, oh, it's lax. Oh, it's tight. We don't necessarily have a comparison per se. What we can do with a finger inserted or with a biofeedback device inserted or with a partner's finger inserted or with a partner's penis, if it's a male partner inserted, we could go through a core breath, inhale, blossom, exhale, draw the penis or finger deeper into you or the toy, and then let that go. And either with our own fingers or with the biofeedback telling us or with our partner telling us, do they feel kind of a hug Do they feel a gentle draw up? And do they feel the let go? So ideally, we would feel those three things. Doesn't necessarily have to be segmented, but they would feel sort of that ebb and flow motion. Some may notice, I don't feel the squeeze part very hard, or I don't feel like there's much of a lift, or I don't see much of a change. I don't know if you're letting go. Sometimes asking somebody to do a max, like the hardest core breath activation they've ever done in their life, or the hardest Kegel they've ever done in their life, sometimes that will elicit a greater relaxation response. And so somebody may then say, oh, yeah, I felt a little bit of the let go there. So if somebody was not feeling much of a hug, not feeling much of a let go, like not a lot of movement, that
Mhm.
could indicate tightness, could also indicate laxity. So it's a bit confusing, right? And so another reason why I do emphasize that people see a pelvic health professional for some guidance, and also have somebody assess you laying down, standing up, even with maybe some movement, different times of the day. So if you're going to see them multiple times, see them at different times of the day, because so many things can influence whether we have tension or not. But yeah, my gold standard is seeing a professional. But biofeedback devices like the PeriFit or the LV, they can help. Like for people that don't have access to a pelvic floor professional, that they can play a role. But sometimes what we interpret as the movement that the biofeedback is showing us could also be the inner thighs, or it could be the glutes. So
Mhm.
we have to be a little bit careful there.
Okay. So going to a pelvic floor PT is the first step in just assessing where we are, having a baseline and getting a sense of any preventative measures we have to take in terms of strengthening our pelvic floor, or making sure we're tending to the health of our pelvic floor. So I'm glad that you said that, because I haven't made an appointment with my a pelvic floor PT. I think my pelvic floor is pretty good, right? And I haven't had any issues, but there are other medical professionals out there. So I wanted to see if you could also tell us the difference. So we know that we go to a pelvic floor PT to just get a baseline of our pelvic floor. But there are other doctors out there, urologists, gynecologists, that I also hear talking about the pelvic floor. When would we go to those doctors, and for what specific issues?
Right now, most women, if they are dealing with symptoms, they're not often asking for help right away. The statistic that floats around, I believe that we have some evidence for, even in research, was about 6.5 to 7 years before they seek help for some sort of pelvic floor or gynecological problem. Unless it's urgent, like they can't poop on a certain day or they can't pee on that would become an emergency situation. But I just mean generally, like incontinence, things don't feel well, it's normal. I can't have an orgasm anymore. I have a little bit of pain with sex. And we just kind of put up with things and think that something's wrong with us, and we're ashamed or embarrassed to ask anybody about it. Then it gets to a point where, like, okay, I have to go. And they'll often go to their family physician first. I would encourage people to make the pelvic floor physiotherapist the first line of defense.
Hmm. Hmm.
The reason is because so much of what is going on, or what can be optimized, can be done with breath, posture awareness, diet, lifestyle, pelvic floor exercise. The pelvic floor physical therapist can also screen for things that may require medical attention, and then direct you on to either back to your family physician, or your family physician to get a referral to a gynecologist or urogynecologist or urologist. Currently, it's slowly changing, but I don't see the reverse happening very often. I don't see a lot of medical professionals referring to pelvic floor PT. There are some for sure, but I still also hear of people who say, oh, pelvic floor exercise won't help you. Pelvic floor PT is a waste of time and money. And I wholeheartedly disagree with that. So I do recommend that your first line of defense be a pelvic floor PT. And they are physical therapists with additional training in the pelvic floor, and they are licensed to evaluate and treat beyond the opening of the vagina through the rectum if needed. And if it's somebody from a male perspective, obviously we're talking about female anatomy today, but men can also see a pelvic floor physical therapist. So that's always my number one. Family doctor is your basic primary care. Gynecologist, typically that it would be, and often it's OB-GYN. So usually it's maternity, fertility, childbirth, postpartum related. The urogynecologists are gynecologists, again, with additional training. And so if somebody was, say, going down the path of choosing or needing some sort of pelvic surgery, I would always recommend they choose a urogynecologist, as they do have additional levels of training. And then a urologist is more focused on the actual elimination pathways, I guess is what I would say. That's not to say that they don't have the understanding of the others. Like I can think of, for instance, Dr. Kelly Casperson, who's a urologist. However, she talks about the vagina and sexual health and sexual wellness and medicine all the time. So there is a lot of overlap between them, but I wouldn't make the medical community the first line of defense. They are there and need to be part of our healthcare team, our pelvic healthcare team. But I always believe pelvic health physical therapist would be the number one.
Okay, that's a great advice. And so when and where do you come in terms of really looking after our vaginal and pelvic floor health?
So I am not a physical therapist. I am a personal trainer. And going back to when I was talking about my story, I recognize that this is a group of muscles that we've never heard about. I went through many different certifications, learning all about all the other muscles in the body. Why did I not learn about this one? And why are we not applying fitness principles to this group of muscles as well? So I'm a personal trainer of the pelvic floor, basically, and I take a whole body approach to where I felt Kegels were missing the mark. We have evidence to show that Kegels do work when they're done correctly and consistently. We also have now research that supports my bias, and that we need to train the pelvic floor dynamically with movement, with exercise, with activities of daily living. So one recent study showed Kegels done prior to resistance training was more effective than Kegels done alone. And another one with elderly women, Kegels done as part of, so incorporating the Kegels into the resistance training workout, people received quicker results than just doing Kegels alone. So my approach is to get women moving in ways that will support their pelvic floor, ideally help them overcome symptoms or prevent those symptoms from happening in the first place. And there are times where exercise is not going to fix things. There are injuries and reasons why exercise won't work, but it still is always level one evidence that it should be the first step. And then if somebody needed further intervention, the pelvic floor muscles are still in the best state possible to undergo potentially surgery or other interventions. So my role is to work in collaboration with the person's healthcare team and not take away from seeing a pelvic floor physical therapist, see them, but they're going to send you home with some homework and some movement and exercise. And I've got a platform that I would say brings a little bit more fun to just a sheet of paper with a few different exercises that you have to do 3 sets of 10 of 3 times a day. So it's very much a collaboration. And I want people to see it that way, that neither one of us is replacing the other. We each bring a different set of tools and education and information. So my program is very lifestyle, nutrition, movement focused as it pertains to optimizing the pelvic floor.
Excellent. So that's your Buff Muff method, right?
Yeah.
Okay, wonderful. So tell us a little bit more about the Buff Muff method. How does it fit in with the prevention, healing, or recovery of pelvic floor dysfunction?
Mm-hmm. As I said before, that people will often wait until there's a problem to fix. They don't think of it as something they need to prevent. And going back to when I started, I was very intent on preventing tearing and preventing the incontinence. I've always had this mindset of, I don't want to wait until something happens to fix it. I want to prevent or minimize the likelihood of it happening in the first place. So that's always been a common thread. And I do recommend that people do this even if they have no symptoms. It's not something that you need to wait until you have a problem and then, oh, now I do pelvic floor exercise. Ideally, it's something I would like to see this taught in schools when they're teaching about menstrual health and sexual health and bodies to kids and teens. Why are we not talking about the pelvic floor and how to exercise it and who to see if we have issues? So hopefully that happens in one day, but that's typically not what's happening. And most of the people that come to me have a problem. So they are now motivated by the symptoms that are getting in the way of their quality of life that they want to overcome. And it's not just join my program and I'm going to have you do 15 different types of Kegel exercises. It's getting to connect with the pelvic floor, understanding the triggers, understanding all of the contributors to pelvic floor dysfunction, fixing constipation, making sure you're drinking enough water. What is your diet like? How much sleep are you getting? What's your stress level like? So it's very much a holistic approach and not just about exercise. And a lot of people come for the exercise, but I also lay the foundation that we need to understand the whys and the reasons behind so that we can make the exercise more effective. And Buff Muff was kind of, again, started out like a bit of a joke where I was teaching these principles of connecting to the pelvic floor and layering it into movement and then progressively loading it. Also adding in the hypopressive method, which I love, especially for pelvic organ prolapse. And I always say like Buff Muff exercises and hypopresses are kind of like the power couple of pelvic floor fitness. But Buff Muff became, I originally had a program called Kegel Mojo. And I then developed this 28-day challenge because people always like to do challenges. And I started saying, okay, come to the challenge and let's buff our muffs. And it was, again, a joke. And then all of a sudden it was like, that seems to resonate people like that. And so then it became the Buff Muff method, which it is now. And people will, again, they come in, they learn the anatomy, they learn the function, they learn about the core, they learn about posture, they get these aha moments that they think, oh my gosh, I've been living in this body for 30, 40, 50. I have sometimes people in their 90s and I've never known this. And I've learned more here than I've learned with 3, 4 doctors. And so it's a very comprehensive program that also gets you moving. And because the other thing, just to kind of wrap up, is so many women stop exercising because of their pelvic floor. They stop participating in sexual activity because of their pelvic floor. They stop socializing because of their pelvic floor. And if we can optimize and get things working well again, all of a sudden they get their lives back. And when we think about the population who I primarily work with, which is perimenopause and postmenopause, our risks of heart disease go up, our risks of osteoporosis go up, our risks of diabetes goes up. And if we are not exercising, those risks are further increased. And then often a big reason is the pelvic floor. So if we can get that working, then we're also going to be supporting our overall health as well.
And so many women turn away from sex and pleasure because of their pelvic floor. So let's bring it back to that. Let's look at some of the movements or practices that you recommend in your Buff Muff method to optimize our pelvic floor for better sex. Can you talk us through a few of those?
Mm-hmm. So first is connecting with the breath. So once we have an understanding of that in and of itself, we can then start to layer in more sensual movement. So we could think about different positions that we may, whether you're with or without a partner. So laying on your back, maybe it's some pelvic tilts, and it's not so much we don't want to make it very robotic, but we start to make it more smooth and fluid in the movement, and we can be visualizing maybe what's happening with our pelvic floor, but maybe something else that's helping us become more aroused. So it could be pelvic tilt. It could be tall kneeling, as we use that term in from a birth position perspective. But if you're on your knees and you have your knees would be, a little bit wider than hip width apart, your toes would be behind you, and you would be sitting on your heels, and then you can lift up off your pelvis and come back down, lift up and back down, incorporating the core breath. So you would inhale and blossom as you're sitting your bum down on your heels. Exhale, activate the pelvic floor and come up, and you could add a little bit of a hip thrust at the top if you like, again, if that helps with that sensation. And you can also incorporate the core breath while you are using maybe a device, if you with or without a partner, again, self-pleasure. And during the arousal phase and as you're getting closer to orgasm, you can also feel the differences in sensation as you relax and as you contract. Because so many people think that if I contract, I'm just going to get this really strong sensation or orgasm. But it's often people will say they feel more pleasure almost when they're in that relaxation phase, when they're in that lengthening phase. So try that out as well. But you can use it with masturbation. So as you're breathing and masturbating at the same time, that can be another way to help. But I always look at, because I'm a fitness person, I think principle of specificity. So what positions, if I'm thinking of it from sex, I think about what positions am I typically exploring sex in, again, with or without a partner. And then how can I basically take that position and make it almost like an exercise, right? And so you could do it as part of your exercise during the day, or you could make it a whole sexual health practice where you're bringing within and bringing the pelvic floor into your awareness.
Yeah, as I'm listening to you speak, I'm reminded of a conversation I had with Dr. Laurie Brotto, who's a fellow Canadian, right? And I'm thinking, oh yes, she recommended using certain stimuli such as a vibrator or erotica, or not only visual erotica, but also audio erotica, to use as a tool that you sort of bring in to stimulate arousal, but then you remove that tool once you get a sense of sensations in the body. Once you stimulate that sense of arousal, you can then remove the tool and sort of move into, invite all of those sensations that you use to elicit or awaken with the tool to then bring into your sexual exploration or your sexual engagement with a partner. And I'm thinking we could do the same thing with your exercises.
Absolutely.
So engaging in the exercises, doing them for a little bit, pausing, noticing what sensations they elicit or awaken in our body, and then move into intimacy or self-pleasure or masturbation.
Yeah, for sure. Lori actually just held she had an event, I think it was 2 weeks ago now. There's a sexual health networking event where there's different presentations up at UBC where she works. So I like sponsoring that event and going and listening to all of the students really are presenting on different research that they're doing in the realm of sexual health. So yeah, I know her very well. She's great.
So incorporating the exercises, the holistic lifestyle really for pelvic care is such a key component of what I call intimate care, right? Intimate care for the vagina, for the vulva. And you would incorporate that. I know that you talk about, I'd love for you to talk about briefly what other intimate care practices we can bring in besides the exercises to look after, to optimize our sexual health.
Yeah, exercise is one component. So we want to make sure that we poop well. We want to make sure that we pee without urgency and without burning. And we want to make sure that the tissues in and around the vulva and the vagina are maintaining their suppleness, their juiciness, their capacity to expand, all the folds within our vaginas that have the capacity to allow things to come in or out if we were giving birth to a baby. But part of supporting that tissue and keeping it healthy is the poop, is hydration, is the things we've talked about. It's also things like moisturizing your vagina. So using a vaginal moisturizer, hyaluronic acid is one of the main ingredients in most, but not all, that seems to, for the most part, be the one that helps people the most. Hyaluronic acid is something we produce in our bodies, but less as we age. And it has the capacity to retain more moisture. So just like we put all sorts of serums and whatnot on our faces, don't take the same ones, but we can apply similar ingredients to our vulvas and vaginas. So a hyaluronic acid-based vaginal moisturizer, and that can be used once a day, multiple times a day, but it does not replace a lubricant. So a lubricant is for sexual activity with or without a partner. And depending on if there's toys or not, and the person's own vaginal microbiome, how sensitive that they are to certain products, they might have to play around with some. But there's water-based, there's silicone, there's all sorts of different types, but one that is supportive of sensation and your tissues is a must. But so a lubricant is not a moisturizer, and a moisturizer is not a lubricant. And then we also have the estrogen piece. So as we are moving through perimenopause and approaching our menopause being 1 day, average age of menopause is 51. After that, we are postmenopause for the rest of our life. And that is, once we reach our menopause, we no longer produce estrogen, and the tissues in our vulvas and vaginas and around our bladder love estrogen. So when there's no more circulating estrogen, those tissues become less supple, less juicy, less folds in the vagina. They're thinner, they're drier, and that can contribute to pain, burning, irritation. It could be pain with sex or insertion. It could just be pain with orgasm, even could be pain with just wearing underwear or movement. So depending on how advanced that depletion goes, the symptoms range from genital symptoms, urinary symptoms, and sexual symptoms, all under the umbrella of genitourinary syndrome of menopause. Statistically, I've seen anywhere between 50 and 80% of women will experience, not necessarily all, but the majority of the symptoms under that umbrella term GSM. And it's another step of where rather than wait for that, knowing how many women will experience that, let's not wait for those symptoms to show up. We know that we will be in an estrogen deficient or depleted state once we reach our menopause. Let's jump in around that time and start supporting with vaginal estrogen. So vaginal estrogen is considered the gold standard with regards to managing GSM symptoms. It's also an important reducer of the risk of urinary tract infection. So our risk of urinary tract infection goes up post-menopause because estrogen helps keep our vaginas in an acidic state. When estrogen is no longer there, our pH becomes more alkaline. We are much more prone to infection, especially if we would have multiple partners or with sexual activity, the friction, the tip of the urethra can often become more exposed as the tissue's thin and dry and they sort of retract. It also moves a little bit closer to the opening of the vagina, again, making us more prone to infection. So vaginal estrogen is not a lubricant. It's not a moisturizer. Lubricant is not a moisturizer. It's not estrogen. So we sort of need and benefit from all three. The moisturizer and lubricant start anytime. The estrogen starting around the time of your menopause, and you will stay on it for the rest of your life.
Yeah. Wow. Thank you so much for that. Again, just listening to you speak, I just get this very holistic 360-degree approach for taking care of our vaginas. And so often, we can have the limiting beliefs that our vaginas are broken. We've gone into midlife. So that means I'm just going to turn away from sex and pleasure altogether. But we don't only need them for sex and pleasure. We need them for lifelong health, vitality, and well-being. And I love this holistic approach that you take. I mean, we take care of so many other parts of our bodies, right? Our brains, our muscles, our bones, the skin on our face. How important you're stressing is the need to look after our pelvic floor, our vaginal and vulval health, just like any other part of our body. And I think removing the stigma and shame from connecting with this part of our bodies is the first step. And I love that you do that just by saying, hi there, I'm the Vagina Coach, but bringing subtle awareness to this part of our body. I love your focus on breath, incorporating nutrition, hydration, exercise and movement, and then these other self-care practices that are also very important: moisturizers, lubricants, estrogen. Wow. It is a whole system of care that we need.
Yeah, and people are just sort of told to go home and do your Kegels. Like that's been the
Yeah.
blanket statement to solve all pelvic health problems for so long, and it is so much deeper, literally and figuratively, than that.
Thank you so much for this illuminating conversation around our pelvic floor and our vaginal and vulval health. I definitely now understand why we need a vagina coach and why we need you. I love your book. I just want to do a shout out to your book, Your Pelvic Floor. It is a practical guide to solving your most intimate problems. If you want a step-by-step guide to understanding your pelvic floor, all the issues that come around pelvic floor dysfunction, anything that you can do to prevent. You have some great exercises in here as well as some breathing practices. Tell us how else we can access your incredible wisdom and protocol.
Thank you so much for having me, first of all, and opening up this conversation. And if people would like to learn more, you go to Google and put Vagina Coach in, you'll find me somewhere. So vaginacoach.com is my website. My social media handles are all at Vagina Coach. And I do have a podcast as well called Between Two Lips.
Oh, I love that name. And you also have other experts specifically talking about pelvic floor health, vulval, vaginal health. Is that right on there?
Yeah, usually I have guests. I enjoy the guest conversations. I like bringing in the village that we need in terms of managing our pelvic health. So most of the time it's me with a guest. The odd time there's a solo episode of some sort. But yeah, I just love, again, bringing in the people who talk about the nutrition piece, how to manage painful bladder syndrome. People are talking about constipation. People are talking about surgery, like all the things that we would benefit from having an awareness about as it pertains to the pelvic floor. Again, looking way beyond go home and do your Kegels.
And you also have a brilliant YouTube channel. Isn't that right? Where you also demonstrate a lot of these exercises.
Yeah, I do share a lot of, I guess, free content. I want this to be accessible to as many people as possible. Yes, I have curated programs. Yes, I have a book, but I also have a lot of free content that people can go and DIY it, because sometimes it doesn't you don't necessarily think, okay, do I need a vagina coach? But that sounds weird. Let me learn a little bit on my own and then I'll go explore after. So it's a way to at least introduce the concepts and the conversation ahead of time. And that might be enough for people. And if they want more, then I've got more to offer.
Yeah, bringing pleasure and power into our own hands, literally. Thank you so much, Kim. This has been wonderful conversation. I've learned so much. I thought I knew a lot about my pelvic floor, but I'm learning a lot more and really taking that holistic approach to looking at this very intimate and very important and powerful part of our bodies. Thank you so much for being here with me.
Thank you. It was a pleasure.
I hope you enjoyed this episode of Pleasure in the Pause. Want to help me spread more pleasure in the world? Hit the share episode button and send it to a friend or post it on your Instagram stories and tag me, Gabriella Espinosa. And if you really love this podcast, please leave a rating or review, as this helps the show get in front of new listeners. Finally, if you would like to access even more pleasure and stay in touch, sign up for my free Pleasure Upgrade Bundle of powerful mind-body practices by going to pleasureinthepause.com. Remember, your pleasure matters.